Hi, this is Dr. Claudia Kim. Today I'm going to be talking to you about a BBL or a Brazilian butt lift. So with a BBL or a Brazilian butt lift, you're taking fat from somewhere else and you're essentially doing liposuction of the areas that you are not happy with and using that fat to volumize your butt and your hips. After surgery, you are limited in what you can do and in terms of your activity levels and exercise. The biggest one being is that you cannot put prolonged pressure on your butt or your hips. Because the fat needs to settle, it also needs to grow the blood vessels because blood brings in oxygen and nutrients and keeps the fat alive. So when you put a prolonged amount of pressure, you're kind of suffocating the fat so that the fat isn't able to thrive. Normally, even if you follow all the rules, usually about anywhere from 50%, this is a generalized percentage, that about half of the fat doesn't make it, which means that the other half that is going to survive, we have to make sure that it's getting the nutrients to be able to survive. So when it comes to the shape of the butt, it can be just a little bit of fat grafting. So let's say you're happy with the projection of your butt, but you have a little bit of the dimpling on the side, what we call hip dips. You can just do fat grafting localized to those areas, versus if you wanted to have a little bit more volume, a little bit more of a shelf. Obviously this is all patient dependent, and so you can kind of customize your ideal shape with the surgeon prior to having the surgery done. Stay tuned for more to come. Bye.